Welcome. During this presentation, we analyse Patrick's medical history, presenting symptoms, and our future healthcare concerns. Patrick is a 78-year-old male who has worsening left-sided heart failure and COPD. He's often very tired, regularly coughs, and his legs are swollen below the knee. Patrick's respiratory symptoms primarily include regular coughing and dyspnea. Patrick has a history of smoking, which is likely the cause of his COPD. Emphysema and chronic bronchitis are the most common conditions associated with COPD. Although emphysema is more likely in Patrick's case, it is highly associated with long-term smoking. Emphysema is the result of damaged air passages, cilia, and air sacs which become inflamed and permanently damaged while losing their elasticity. This leads to a reduced lung capacity and increases the likelihood of developing a secondary respiratory disease such as pneumonia. Ultimately, Patrick has done well to quit smoking, but unfortunately this has left him with emphysema. Although emphysema is incurable, it is manageable. Patrick's heart rate is abnormally high for an adult at 155 beats per minute. For adults, the normal resting heart rate ranges between 60 and 100 beats per minute when relaxing. There are a number of risk factors that are likely the cause of Patrick's tachycardia. Firstly, his emotional stress is likely high at the moment. As he would be concerned by his current condition, stress can cause the heart rate to increase as the sympathetic nervous system is activated and adrenaline is released. Secondarily, Patrick likely suffers from emphysema due to his history of smoking. This reduced lungs' ability to exchange gases. Therefore, his heart is attempting to compensate for his lungs by pumping additional blood through in an attempt to increase the gas exchange required by his body. In conjunction, Patrick's medical history of myocardial infarction and worsening left-sided heart failure. This has likely impaired his cardiac output, and therefore the heart has to beat faster to push sufficient blood to his lungs. Lastly, Patrick is pre-obese and lives a sedentary lifestyle, walks slowly, and likely becomes short of breath very quickly. This largely prevents his muscles in the body from passively aiding in moving blood to and from the heart. Therefore, his heart condition must quicken to ensure blood is sufficiently pushed throughout the body. The diagnosis for his COPD is related to his history of smoking for 40 years. Healthy lungs filter the airway we breathe. When pollutants enter the lungs, they are trapped in a mucus coating, and tiny hairs, known as cilia, sweep away the harmful particles, removing them from the lungs. Smoking permanently damages the cilia and alveoli, leading to emphysema. Patrick's left-sided heart failure developed after a myocardial infarction to a branch of his left coronary artery. A myocardial infarction is a result of reduced or prevented blood flow to the heart, resulting in scar tissue that does not contract efficiently or effectively. Smoking also increases the risk of myocardial infarction as it damages blood vessels, raises blood pressure, stresses the heart by reducing the amount of oxygen in the blood, and increases the heart rate. Long-standing hypertension leads to an increase in arterial pressure in systemic circulation, making it harder for the left ventricle to pump blood. To compensate, the left ventricle muscles hypertrophy so that the ventricle can contract with more force. Increase in muscle mass means there is an increase in demand for oxygen, and the coronary arteries become constricted by the additional muscle, resulting in even less blood being delivered to the myocardium. Increased demand and reduced supply means the ventricular muscles start to weaken, leading to left-sided heart failure. Smoking is the primary cause of Patrick's emphysema. High blood pressure and coronary artery disease are the main reasons for left-sided heart failure. There is a secondary relationship between his diagnosis of COPD and his left-sided heart failure. These two complications have developed independently due to different reasons, but they do aggravate each other. When blood is not oxygenated well due to COPD, additional stress is placed on the heart, which worsens the symptoms of left-sided heart failure. In addition, when there is excess fluid in the lungs from left-sided heart failure, it can increase the breathing difficulty for those with COPD. As Patrick suffers from left-sided heart failure, he's now at an increased risk of developing right-sided heart failure. If either side of the heart is affected, it will affect the other since they work in series. As the heart is unable to pump blood towards the body, the blood backs up to the lungs. Fluid builds up in the lungs, leading to an increase in in the pressure on the pulmonary arteries and increase in pulmonary blood pressure, putting increased strain on the right side, making it harder for the right side to pump blood. Since the right side pumps blood to our lungs from the body, the blood gets backed up into the body, which can cause fluid buildup in the lower legs. According to Patrick's blood test results, he has abnormally high parameters, including high sodium. This level can be connected to Patrick's age, weaknesses, heart rate, and swelling below the knee. Patrick's potassium is high, which is associated with kidney disease, medication for high blood pressure, and heart failure. In Patrick's case, his left-sided heart failure will likely be the main factor. Patrick's hemoglobin levels are low compared to the normal range. This can be connected to Patrick's heart failure, lack of exercise, and a long history of smoking. Levels of LDL is high. This can be connected to Patrick's history of left-sided heart failure, smoking, pre-obesity, his BMI, high blood pressure, and low level of HDL. HDL and LDL are interrelated as HDL affects the level of LDL. In Patrick's case, the HDL is low, which is connected to high blood glucose and levels of triglycerides, smoking history, sedentary lifestyle, and pre-obesity. High levels of triglycerides leads to diabetes type 2, heart disease, and stroke. Patrick has pre-obesity, high blood pressure, high blood glucose, and low HDL. In addition, the high glucose can be connected to developing diabetes type 2, same as high blood pressure, abnormal cholesterol, and triglyceride levels, age, inactivity, pre-obesity, and any cardiovascular disease, which is heart failure and myocardial infarction to a branch of his left coronary artery. Patrick's neurological function is likely affected as hemoglobin is crucial in maintaining an oxygenated blood supply. Low hemoglobin results in a low supply of oxygen to the brain, which can cause brain damage and cognitive decline, including Alzheimer's or dementia. Hypoglycemia may also contribute to brain damage because of insulin-degrading enzyme. This is a product of insulin that breaks down both insulin and amyloid proteins in the brain, and it is the same protein that build up and lead to Alzheimer's disease. People whose bodies are unable to produce insulin will not make enough of this enzyme to break up the build-up. Those who use insulin treatments end up with a surplus insulin. This enzyme then gets used breaking up the insulin. Therefore, the body does not have enough of this enzyme to break up these brain clumps. There are two cardiac hormones, B-type natriuretic peptide, BNP, and arterial natriuretic peptide, AMP, which determine the constriction and expansion of veins and arteries. They also participate in control fluid and salts from the kidney. If unbalanced, the heart is unable to pump blood. The walls of the ventricles become increasingly strained or relaxed, leading to a change in blood pressure and the level of fluid. Therefore, cardiocytes begin production of natriuretic peptides to balance the fluid in the cells and blood pressure. Because he still has left-sided heart failure, we can assume the level of BNP can be increased in the blood. People without any problems with a heart level is 53 to 91 pg per milliliter. In this situation with Patrick, the level of hormone in blood will be greatly increased. We can also parallel with Patrick's condition, swollen feet, fatigue, an increased heart rate, ex-smoker, coughing, and dysmenorrhea are symptomatic indicators of increased hormone level. Thank you.